Burkholderia pseudomallei, formerly known as Pseudomonas pseudomallei, is a dangerous rod-shaped gram-negative bacterium. It lives naturally in tropical soils and surface water. It is a highly resilient organism that is naturally resistant to many common antibiotics, and it causes a severe life-threatening infections in humans and animals called melioidosis. Mortality rate. The mortality rate for this infection is exceptionally high. Survival depends heavily on how quickly a person gets the correct treatment. Without treatment, the mortality rate is 80 to 90%. The bacteria can quickly enter the bloodstream, causing severe blood poisoning and organ failure. In resource-limited areas, the mortality rate sits around 40 to 50%. In rural clinics, a lack of advanced intensive care equipment makes it harder to save patients. In advanced healthcare settings, the mortality rate drops to 10 to 20%. Modern hospitals with a rapid testing and immediate intensive care significantly improve a patient's chances of survival. Habitat and transmission. It is found mostly in tropical regions like Southeast Asia and Northern Australia. It has also been found in parts of Africa, South America, and the Gulf Coast of the United States. People contract the infection by breathing in contaminated dust, drinking dirty water, or through direct skin contact with wet mud and soil, especially if there are small cuts or scratches. Cases often spike after severe weather like heavy rain and hurricanes. People with weaker immune systems are vulnerable. The single biggest risk factor is diabetes, followed by chronic kidney disease and heavy alcohol consumption. Medical diagnostics. In a laboratory setting, diagnosing B. pseudomallei requires strict safety measures. The bacteria has specific traits. The safety pin look under a microscope. A gram stain often shows rod-shaped bacteria with darker tips on both ends, making them look like tiny safety pins. Prickly condoleezza. When grown on special lab gel plates like ashdown agar, the bacteria grow distinctive dry and wrinkled purple colonies. Gold standard tests. Culturing the bacteria from blood, sputum, or urine is the most reliable way to confirm the illness. Modern labs also use advanced mass spectrometry to identify the specific germ quickly. Medical management and treatment. Because the bacteria are naturally resistant to standard penicillin and gentle oral antibiotics, treating melioidosis is difficult and requires a strict two-phase treatment plan, 1:1 and 1:2. Phase 1, the intensive phase. The patient receives heavy-duty antibiotics directly through a vein for a period of weeks to keep the infection from turning deadly, e.g. 1:1 and 1:3. Doctors typically use medications such as ceftazidime or meropenem. Phase 2, the eradication phase. To prevent the hidden bacteria from waking back up, bacteria from waking and causing a relapse, the patient must take oral antibiotics for several months, e.g. 1:1, 1:3. The standard medication used for this phase is TMP as a max.